information gained from viewing the following program is not a substitute for regular exams by your physician and does not constitute a doctor-patient relationship. All information gained should be discussed and confirmed by your physician.
Hello, welcome to Healthy, Wealthy, and Wise. We're glad you've joined us today. Our guest is Dr. Mickey Ask, a physician at the Loma Linda University School of Medicine and the VA hospital here. He's a fellow of the American Society of Addiction Medicine and also has a board certification in internal medicine with his emphasis in preventive medicine. Mickey, we're so glad you joined us today. We're going to discuss alcohol dependency and addiction.
Okay, thank you.
Mickey, tell us, what's the magnitude of the alcohol problem here in the United States?
Well, there's lots of different studies and statistics on all this, but it's probably about 10%, about 1 in 10 people that at some point in their life will develop a problem, either abuse or dependence. And it's when you look in different cultures, different societies, different countries, there will be about that percentage depending on, say, the laws and how permissive the society is. And the problems, as I've traveled around, the limited traveling I've done to other countries, it's interesting to me that the process is the same, the concerns are the same, the issues are the same whichever country we go to.
Sure.
What are some of the predisposing factors? I mean, it seems like a lot of people are involved with this and almost everybody knows of someone that's had a problem. So what are some of the predisposing factors for becoming addicted to alcohol?
Well, certainly growing up in a home where family members have it and seeing it around, having drinking being a part of the family. So the more that alcohol is available, the more people will try it, and then it increases the risk of and the numbers of people that get into trouble. So just having it around is an issue. Of course, another factor is the genetics of this. If you take it's difficult to get animals to drink in general, so they're a little smarter than we are sometimes. But if you give rats only ethanol, only alcohol, deprive them of water, eventually some of them are going to drink it. And then you take the ones, that group that drank it first, breed them among themselves, and then continue to do that on successive generations. After about 18 generations, you can actually develop a strain of rats that chooses ethanol over water when given a free choice. So something genetic is clearly going on.
Are there some humans that do that too, choose alcohol over water?
Well, certainly it is. And some of my patients, their parents gave it to them in their bottles just to try to help them sleep and keep them quiet. Had one patient who's drinking alcohol, having a beer with a meal with his dad. His dad had him do that. Other patients that it's their parents that turned them on to marijuana. So you have both factors, the genetics and the exposure to it.
And some of those drugs like marijuana predispose to becoming alcoholic later?
Well, this idea of gateway drugs used to be ill thought of at first they thought it was a good idea, then they fell out of favor, and now it's somewhere in between, that the legal drugs are the ones that are the most available, so alcohol and nicotine. And actually, if you can prevent a teenager somehow from smoking until beyond age 18, the chances of them having addiction problems in general is much lower than if they experimented with alcohol early on. So the ones that are most available, alcohol and nicotine because it's legal, and then marijuana is fairly available. And if there's experimentation with that, it puts them in that group that then are more apt to go on and try other things. Doesn't mean if you smoke or use marijuana that you're going to end up being a cocaine addict or a heroin addict, but it certainly puts you closer to that environment and puts you more at risk.
That's an important thing to be aware of, because it would seem that we should do everything we can to prevent the problem. It seems so common, and yet it's not really recognized as much as it might be. So we need to talk about the recognition to a significant degree, don't we?
Certainly, if you have a family member that uses, and especially who has had any degree of problems, that increases the risk. So I think we should relate to it just like we would if my dad had a heart attack at age 50. I'd be mindful, I'd want to know, well, what can I do to prevent that occurring in me? So I'd take a look at my diet, I'd take a look at exercise, I'd have my cholesterol monitored, I'd go to a professional and ask them questions and have them scrutinize me more closely. So the same thing if I have alcohol in my family, I would want to go to a doctor and say, how can I prevent this? And the easiest way is just to decide that, okay, for me, I'm not going to even try to be a social drinker, because it's much harder to try to control my alcohol use if I'm using it than if I'm not using it. And in fact, the very issue of being aware of when I've had too much is one of the problems in people with a genetic predisposition. We can train non-alcoholics how to be aware of what their blood alcohol level is. So you give them a certain amount of alcohol, you measure their blood alcohol level, and then you educate them what that is, and they can kind of get a sense of it. Whereas alcoholics, we can't train. They literally do not have the hard wiring to be aware of when they've had too much. So this is the person that you just saw pack away 6 drinks at the restaurant, and he says, I feel fine, I can drive, let me drive. They do not feel the effects in the same way that a person without the genetic tolerance will.
It's fascinating about that difference. Well, then it appears to me that if you have any of that predisposition or genetics, then the way to be sure you're never going to be an alcoholic is to never take a drink, because if you don't, then you'll never be an alcoholic.
Now you might manifest addictive behavior in other realms, so you could then not be alcoholic, but then you might have an eating problem, might have a gambling problem, might sexually act out, might work too hard and have a compulsive element to even your hobbies. So you have to be, it's not just a hobby, you have to be the best, and you're spending thousands of dollars on your hobby, and it takes up all your time, and it separates you from your family and your relationships and keeping fit and so forth. So there's many ways in which addiction can manifest itself. It's not just drugs. But certainly, if you don't take that drink, and it's okay to not be a social drinker with you because of your family history, it makes perfect sense. I don't think those of us coming from a religious background where abstinence is the norm and the goal, we don't have to feel defensive at all in relation to the secular population about taking a stance of not using it all. It makes perfect sense from a public health standpoint, because the reality is even people without family histories and genetic predisposition can develop problems, and you can't predict it. You can't tell who is going to develop problems and who is not.
I often hear people say, I really don't drink, I'm just a social drinker. Tell me, what is a true social drinker?
So I prefer the way that you said it, a true social drinker, because sometimes we say a heavy social drinker, which is always a little confusing to me. But a true social user, when I do histories on patients, is somebody that uses alcohol infrequently. So meaning New Year's, a special anniversary, a wedding, where there's a small amount that might be used. The focus is not the substance. The focus is not getting a buzz or getting a mood effect or getting high from it. They would have just as much fun at this event if alcohol was not there, would not be missed. They don't look forward to the get-together because of the substance that's there. If it's there, okay. If it's not, that's okay too. And it's never more than a drink or two. 3 at the very most, but it's spaced out. They would be eating with it. They wouldn't be drinking on an empty stomach. They might not even finish all of the drink. A good alcoholic, when I ask him now, what do you think about people that leave part of the drink? And they're shocked. It's almost like, well, that's wrong. It's wasting alcohol, you know. So, so those would be some of the characteristics that I would look for.
So if I have a family member or friends that tell me they're social drinkers, what would be the warning signs if they went into a different category and stepped beyond the social, quote, drinking?
So one of the first things I would look at is that there are certain personality characteristics that are more apt to experiment, and then of course if you experiment, more apt to get into trouble. So the sensation seeker. So this is a person, we all have friends that are easily bored, they're kind of restless, they're stirring the pot. If everything's nice and quiet, they have to say something or do something to get everybody going and create some chaos. They're kind of unpredictable, and if it's to a certain degree, it's kind of fun, it's exciting, they're fun to be around. It stirs us lethargic types up and makes our life interesting. But they're also, they'll test the limits, and some of this is developmental as you progress through your teenage years. Some of this is normal behavior because you're learning the limits, and we test things, and that's the way we learn what the limits are, is by testing it. But as it progresses, then they don't respond to rewards or punishments. So we talk about low harm avoidance, low reward dependence. So those would be some of the traits that I would be mindful of, and then if they do start using alcohol, then I'm going to be more concerned. Any trouble at all. So getting inebriated, getting tipsy. So again, now we're not talking social use, even though in our society we think it's funny, it's cute when people act drunk. We have all these drunk jokes. We don't have much epilepsy jokes or diabetic jokes. We have all these drunk jokes, and it's because they do act outrageous, and it is funny. But the reality is, this is somebody that's very impaired. This is somebody that can hurt themselves, can kill others, not intending to. So it's a very serious issue. So any problems, drinking more than a drink or two, and if they have a problem, not being able to learn from that. So continuing to use even though there have been problems. Those are some of the characteristics that would concern me.
Sure.
So those are kind of danger signals that one would want to look for. For those of us in the religious community, or who've grown up not really seeing alcohol used much, or not having any desire, or kind of taboo in our society, if you will, is there a kind of unwillingness to face those issues when they show up in a family member? Is that more likely to be the case? Try to hide it perhaps, or push it under the rug?
Well, if we drink and take something or do something that violates our value system, or say that let's start with even the issue of drinking in an environment where you're not supposed to drink at all. So what that does now is it creates some guilt, and so then we have a tendency to hide, and we don't want to talk about it, and so we're not able then to avail ourselves of the general knowledge around that issue, so that we're getting a sense of what's appropriate, what's not appropriate. When we have problems, again, we're not supposed to have problems. We're not supposed to get angry. We're not supposed to have depression. So we don't talk about it. We don't get help when we do need it. That could be maybe very easily resolved. So that the guilt, which then eventually, if it's repeated, short-term guilt is a necessary element that all of us need. But if it doesn't get resolved, then it becomes chronic guilt, and that can then have a deleterious effect, where now it's not just I'm doing bad things, it's I must be a bad person because I keep doing bad things, so maybe there's something wrong with me fundamentally. And the same thing happens in families. Well, I must not be a good parent because look, I have this kid that keeps getting into trouble. So then the family members isolate, don't want to invite people over because it's too unpredictable what's going to happen. So we separate ourselves from our friends. We always put on the good face. Well, how are you doing? Oh, I'm fine. And so we never really talk about things. And then we become caught up in the problem and get stuck also. So certainly in a environment, a culture where there's high standards. Now, so what's the solution to it? Should we have low standards? Absolutely not. We should have high standards, but allow ourselves to admit that while we have a high standard, we're not there yet. So in Alcoholics Anonymous, which we'll talk about more later, they have a saying that, that sums it up very nicely for me. It says that we can't claim perfection, but we can claim progress. So as long as we're making progress, whatever that is, developing maturity, growing in knowledge, it's okay to be ignorant, so not okay to be rebellious. So I think it's important to make those kinds of distinctions.
That sounds like a pretty good motto for all of us in many arenas, doesn't it? In other words, don't just give up on it because you're not perfect yet. Some of those texts that we grapple with in Scripture that have to do with perfection, I think probably have some relevance here, that making progress is really what it's about, and growing.
And that's really what the biblical term perfection means, is maturing. You're staying in that process. Like Jesus said, it's first the seed, then the plant, and then the corn, and then it develops into the fully mature fruit. So he's describing that process, and as long as you're where you need to be at any stage, even if you're not at the end stage, that's all you can do. That's perfect.
That's certainly encouraging, and should avoid some of the depression that can occur when a person's trying to match themselves with something that seems unobtainable, far beyond.
Mm-hmm. It's a process, not an end point.
What about the resistance then to accept this, and how do especially people who have had these high standards and seems like they themselves or maybe their family members not achieving those standards, what's the key then to overcoming that and to accepting and recognizing?
Well, one of the ways to conceptualize it is that, well, a person is just in denial. They don't want to admit it. So how do we deal with that? Well, we say, okay, well, maybe it's because they really don't know better. So they're just ignorant. And so we give them more education. Well, here's what drugs do to you. Here's how it affects your brain. Here's your brain on drugs. And here's what happens to your liver. And so for some people, that will help, and that will help them avoid then even experimenting and keep it in check. Others, if we conceptualize it as solely maybe we say it's a rebellious issue. Well, they're just doing drugs because they want to make us irritated. So we'll show them. So we'll punish them, or we'll throw them in jail. Okay? Though some of my patients, in fact, a lot of my patients are still using in jail, and they say it's easier to get drugs in jail or in prison.
Oh my!
Some of the guards are bringing them drugs. Okay, so I don't want to overstate that, but I always ask them, so how much you've been using in prison? And they have to make a choice there also. So, or they'll get out, maybe they don't use, they'll get out, and the day they get out, for some of our heroin addicts, they'll have what we call conditioned withdrawal. Now that they know they can get it, they go into classic heroin withdrawal symptoms. Cramps, goose flesh, tearing of the eyes and nose, and the craving, even though they didn't have craving for 10 years while they were in a controlled environment.
That's astounding. Does that happen with alcohol too?
It's not as powerful an effect, but the craving, we talk about the obsession of the disease, that constantly thinking about it. Even when they're not drinking, they're still focused on the alcohol. And this can happen for years afterwards, so it can vary.
Does that apply to marijuana, cocaine, or is it specifically more the heroin and the alcohol?
Each of the drugs has it to varying degrees. In fact, nicotine is the most powerful because if you smoke a pack a day and 20 cigarettes a pack, say 10 puffs a cigarette, that's 200 hits in a day. So, and the problem is that when we have a repeated habit, an action, or a feeling, it actually becomes literally hardwired in the brain. There's pathways that are now newly created to make us do that action easier. That's what habits are for. When we want to change our habits, those old wiring does not go away. We're just building new ones. And so that's why it's one reason why it's so easy to relapse, is because those old pathways are still there. So instead of just trying to overcome the denial, it's better if we try to work with a person. And so there's the techniques that we call motivational interviewing that try to align themselves with the person that has the problem and get the concern from their standpoint and work with where they're at. The best thing, though, for a family member or a friend is to try to talk to a professional, go to an AA meeting or an Al-Anon meeting, which is for people that have friends or family members, and just sit through a bunch of meetings, 6 meetings, 10 meetings, and just listen and get some input so that way you can help yourself figure out whether there really is a problem or not. And talking with the other people there is the best way to figure it out.
If I live in a community maybe where there doesn't happen to be an AA, what type of medical specialist would be the best one to start with?
Well, first of all, there's AA meetings, 12-step meetings everywhere.
Everywhere.
So looking in the yellow pages, under Alcoholics Anonymous, there will be an office to call. Getting on the internet, they're under Alcoholics Anonymous, AA.org, I think it is, and looking there you can find meetings in your area. The other place is the American Society of Addiction Medicine, so that's asam.org, and contacting them and asking for a referral from a certified specialist in addiction medicine. So that would be the best source for getting help.
That's good information to have. I think a lot of people often wouldn't know quite where to start. In this day and age with the internet, that would be a good place to start, or like you said, in the yellow pages.
Contacting Loma Linda, and I'm willing to answer questions, so they can give out my email at the VA, and that would be fine too.
Great.
When family members recognize a problem and just don't know where to turn, then one of these resources could be a huge help. The Al-Anon, tell us a little bit more about the Al-Anon approach and how that seems to help people.
The part of the problem with trying to help somebody with an addiction problem is that they do need help, and so we find ourselves stepping in and trying to pick up the pieces. I had one lady that brought her 21-year-old son to me and was worried about his heroin problem. I talked to him and he didn't seem concerned. He wasn't quite sure why Mom was unhappy and concerned. So I turned to her, come to find out she is letting him stay at home. She's doing his cooking for him, his cleaning for him, finds herself loaning him $20, which he ends up using to buy heroin, and she knew that would happen, and driving him into Los Angeles so that he could buy his heroin. All thinking that if I keep helping him enough, that will show him how much I love him, that will motivate him to change. Well, of course, for him, the message was, what do you mean, heroin? So I don't have a problem. So first of all, it's not stepping in and trying to fix it for them, but not supporting them in their disease. So not loaning money, setting limits. I love you too much to watch you hurt yourself. I'll help you get help. I'm not going to make it easy for you to keep using. So it's a free country. If you want to keep using, that's up to you, but you can't use in our home. You're going to have to leave. I'm not going to loan you money. I'm not going to support you anymore. So that's not uncaring, that's caring enough, and only love gives you that motivation.
It seems that a codependency kind of situation develops often.
It's the same process in the family members. They become trapped into trying to help the alcoholic even though their efforts are futile, just like the alcoholic is trapped in relation to the drink. The alcoholic's lives revolve around the drink, the family members revolve around the alcoholic. So instead of trying to help the alcoholic, they should first start to get some new thinking for themselves and help themselves by going to Al-Anon meetings or Nar-Anon meetings for those that have drug problems.
Drug problem.
I suspect that some of the problems that people have are because they don't want friends and neighbors to know about it. They don't want to accept it for themselves. How do you get over this barrier of the individual that has the problem not wanting help? Is there some way that can be addressed?
Well, this is where the idea of doing an intervention comes in. So because of the inability of the person to recognize the extent of the problem, getting the family members and the concerned others together, and it's not about being confrontational or demeaning or overbearing. It helps to have a professional help you with that, and any treatment center usually can refer you to somebody that can do interventions. But getting people together, sharing their love, sharing their concern, and presenting all the facts in one setting rather than being irritated and saying something, or being angry or discouraged and saying something, and the person with the problem just says, oh, they're just in a bad mood today. But you get everybody together at one time, sharing your concern, and then having a solution, then a lot of times that can be a very effective mechanism. The other thing to be aware of is that there can be psychiatric problems and other factors, chronic pain, depression, post-traumatic stress issues, especially with the vets now returning, that contribute to drinking. So they can't sleep, they maybe get angry easily, and so alcohol numbs that. So it's important to look at other predisposing characteristics that need to be addressed also.
It sounds to me like that there's so many things available, and yet if you see the primary care physician, oftentimes they're too busy to really be of any help. So things get to be a vicious cycle, and you don't start to get out of that. Are there medications that can be helpful? And that's a little tricky using those, I suppose, in those settings.
Well, the problem is not because of a lack of a particular pill. So a medication should always be in the context of a broad context of helping that person develop skills, getting educated about the nature of the problem, having some humility and being willing to ask for help, learning how to avoid stresses and problems that lead to drinking. But the medication can be very effective. Antidepressants can be of use. There's anti-craving medications. And for some people, going on maintenance medications that, even though you'd rather not be on a medicine, it still prevents a much bigger problem. I would avoid tranquilizers. Anything that is a downer, sleeping pill, anti-anxiety pills, those are the main ones to avoid. And also being mindful of the risk of opiates or narcotic pain medicine to addiction also.
So the bottom line is that there's a lot of help out there. We just need to be aware of what can be done and do our best to, as a family and loving members, not be supporters in the wrong direction, but do the best we can to help and find these resources.
We need to pray for wisdom that we will be supportive in the right way.
Our prayer for you today is that every day you will adopt these principles for good health that we've been talking about. And remember Proverbs 17:22, a merry heart doeth good like a medicine. You're watching LLBN TV.